Good evening and welcome to RFL. I'm Richard French. Now we're going to start the program focusing on COVID, but before we get to the outbreak, I'm going to have to take you to a trip called Crazy Town. That is thanks to Rudy Giuliani and his boss, President Trump. Rudy today speaking to the press, and in an hour and 45-minute press conference that was at times bizarre and at times far worse, he threw out more conspiracy theories and baseless allegations than you can name. We're going to show you some of the lowlights in a few minutes. His boss, the president, actually bringing state lawmakers, or trying to, from Michigan to the White House this Friday as he tries to coerce them into overturning the results in that state. Unbelievable. All of this happening as the president still refuses to concede or cooperate, for that matter, with Joe Biden's transition. And speaking of Michigan, some Republicans in that state, they're talking about impeaching Governor Whitmer over the new COVID safety measures she's putting in. But thankfully, the House Speaker, who's also a Republican, shot down that notion before it gained too much traction. But still, it all shows you just how nuts things are out there as the virus continues to spread out of control.
Right now, we are in a absolutely dangerous situation that we have to take with the utmost seriousness. This is not crying wolf. This is the worst rate of rise in cases that we've seen.
And today, for the first time since July, the White House task force held a briefing to update the American public. President Trump, of course, was MIA. Vice President Mike Pence took charge. Dr. Fauci, one of the people who spoke.
We need to actually double down on the public health measures as we're waiting for that help to come, which will be soon. We'll be getting vaccine doses into people at high priority at the end of December. We're not talking about shutting down the country. We're not talking about locking down. We're talking about intensifying the simple public health measures that we all talk about. Now, I've used that metaphor that the cavalry is on the way. If you're fighting a battle and the cavalry is on the way, you don't stop shooting. You keep going until the cavalry gets here.
Also today, Joe Biden and Kamala Harris, they held a virtual call with many of the nation's governors, and they discussed ways to improve coordination between D.C. and the states.
Our message to our governors and to all of our nation's state and local leaders is simple. President-elect Biden and I will make sure you have the resources and support you need to save lives and help get our economy back on track. Because when it comes to this pandemic and the economic recovery, we are not Democrats or Republicans. We are Americans, and we will be there for one another.
A little different than the red state, blue state thing that we've seen throughout this crisis under this administration. Now, each new day, it brings alarming new COVID numbers. In just the past 24 hours, nearly 2,000 Americans have died. 172,000 have tested positive for the virus overall. More than 250,000 people have lost their lives in this country, and north of 11.5 million people have tested positive. As conditions worsen, the mayors of Chicago and St. Louis impose stricter limits on gatherings. Governors of Oregon, New Mexico issuing stay-at-home orders. And now, nearly 80,000 people in America are in hospitals battling COVID as we speak. Many of these hospitals so overwhelmed, they're putting beds in cafeterias, waiting rooms, even parking garages.
As we talk about making tough decisions, it really becomes, as you start to run out of space, who gets the next bed? Where does the next patient go? And more importantly, where do you keep patients if there's no more capacity left in the state? The message is simple. The rate of spread is not sustainable.
Staffing is also an issue, and doctors and nurses, they're being forced to work double shifts. In some places, hospitals are so desperate for staff, people who test positive go right back to work as long as they are asymptomatic. Now, many of them, they're speaking out about the challenges they face and the strain that they're under.
Some days you go to work and you really hope that just someone doesn't pass away on your shift. Some days you go home and you really just hope that your patient's still there the next day.
With that, though, there is progress to report on a vaccine, and it is significant. Pfizer, they could seek emergency approval for its shot by the end of this week. Now, the drug company announced its treatment was 95% effective in late-stage trials without side effects. Amazingly positive news. Plus, you got Moderna saying it's testing its vaccine that could also be close to 95% effective as well. The first round of people, including healthcare workers and nursing home residents, could start getting their shots as early as possibly next month. But before we get there, and before maybe till summer when the rest of this country will be fully vaccinated, let's hope, we have many challenges. So I want to bring in my next guest, who is certainly equipped to answer these questions and more. Kathleen Sebelius. She's former HHS secretary under the Obama administration, and also she was former governor of Kansas. Now, I fully expected to talk nothing about COVID right now, but I got to ask you, as a former member of a cabinet and a governor, we're in crazy town. I mean, I listened to Rudy Giuliani today create a total alternate universe as to what happened in a free and fair election. I've got the president reaching out to state legislators in states trying to get them to send a whole different slate of electors for states that he lost fair and square. I've got Michigan lawmakers talking about impeaching the governor because she wants to make people wear masks. I know it's a political term, but this is nuts, right?
Well, I think that sideshow is nuts, and it is doing nothing but undermining the notion that we have free and fair elections. We have transfer of power, that if you lose, you wish the winner well, and you make sure that he or she knows how to continue to operate the government. That all is pretty terrifying for the American public. More terrifying is that we are in the midst of an enormous health crisis that is getting worse by the day. And we have a president who refuses to even acknowledge that it's going on. He can only talk about his own grievances, his alternative reality, as you said, his made up facts about the fact that he really won if you'd only count these mythical votes that he got. So it is a very frightening place to be right now.
I want you to listen to what Congressman McCarthy, he's minority leader in the House for the folks who don't know, Republican from California. Listen to what he had to say when asked about obviously sharing information in a transition with President-elect Biden and his team.
You have one president at a time. We have the military putting through and planning this ahead of time. So I want to follow through, and if we can get people the vaccine next month, let's do it. That is what's going to save lives. Playing politics with this is wrong.
You went through, you were part of a transition when you were in the Obama administration. Can you give an idea that it's not just about, picking, which drapes you want in an office here? There's a tremendous amount that goes into it under normal times, let alone in a pandemic. This idea that we can't walk and chew gum and share intelligence, and that, by the way, it's the Biden folks playing politics with COVID and the vaccine, that's another story. But address what you just heard there, that it's not important or necessary to share information with an incoming administration.
Well, again, I would say, in all due deference to Congressman McCarthy, he has no idea what he's talking about. This isn't about playing politics. That's what the president is doing. We have always had a transition. Frankly, the papers were signed months ago between the Biden administration and the Trump administration. They have had exchanges of information at a high level. What happened, though, is that the Trump administration refuses to acknowledge the free and fair election that went on. So they've ground to a halt what should be an accelerated process. The day after the election, the incoming president should be able to send the so-called landing team into every agency to begin to investigate from the inside where the gaps are in the agency, what the knowledge is, what the career staff is thinking about. This is the worst health and economic crisis that any of us have ever experienced. And so having very detailed conversations about what kind of planning is underway for vaccine distribution, Where is it going? Who has the contracts? What do governors expect from the federal government? What can the Biden team tell governors about what they should expect?
I have a logistical question. You have the great news is it seems that we have, Madam Secretary, all these terrific vaccines that are coming out, but there's multiple pharmaceutical companies that are producing. We might even get terrific news from 2 more as early as next week. But they're not identical. As I understand it, you've forgotten more than I know. They can be stored at different temperatures. There's different requirements and necessities needed to be able to store these safely. How does that work? How does it get coordinated? Is it by geography? Who decides what's getting AstraZeneca versus who's getting Pfizer versus Moderna, et cetera? It would seem to me, I know the CDC is taking point on this, but that's a huge undertaking, just the logistics of it.
Think of a poll that is done where you get a top line saying 70% of people feel that apples are red. And then inside that 70%, it's older white women think they're mostly red. Younger African-American males think some of them are red and some of them are green. I mean, you get a sort of inside tabular accounting. That same kind of thing is available in these clinical tests. And that will be part of what the FDA looks like. Is one vaccine more effective among older, vulnerable Americans with comorbidities than the other? Is one safer for kids? What about the booster effect? Who on the front line should get the Moderna vaccine over the Pfizer vaccine? That can be unpacked by the FDA. It's very unlikely that you will have all of the candidates with identical profiles underneath the 90th, 95% effective. Then you have, where are the manufacturing sites? The vaccine has to get from that one site with the right packaging to store at the right temperature to 50 states and tribal areas throughout this very vast United States. And it has to get to the vulnerable populations in those states first. So you're absolutely right. This is a massive logistical issue.
A question of your home state, and we've seen surges now. Everyone I've talked to in the medical field is dreading what 2 weeks after Thanksgiving will look like. How about the capacity for the hospitals to handle what's coming? And on top of that, we have slated next month, the federal government's getting ready to basically turn off the financial spigot for a whole bunch of folks. That's on top of all the folks that have already fallen short. So both capacity from the medical side and also the financial dereliction of duty out of DC for so many people, using your home state as a benchmark, how worried are you what the end of this year is going to look like?
Well, I'm very worried. And I think we are already seeing capacity overload in we ran out of hospital space long ago in many of the rural communities in Western Kansas. They began sending patients to regional centers. Those centers are now full. Our cities are now full. Kansas City, the big hospital system associated with the University of Kansas Medical School in Kansas City, has stopped all elective surgeries. They've stopped letting other people in, and they're beginning to call surrounding states for capacity, but none of the surrounding states have any capacity because we're in a national crisis. And if they have hospital beds, they don't have personnel. That's part of the problem in some of our smaller, more rural areas like Kansas. Europe, on the other hand, dealing with the second wave, has done 3 things that I think we need to take very close watch on. They have a unified message with leaders across borders. So Germany is saying the same thing that Great Britain is saying, that France is saying, that Spain is saying, and they are prioritizing kids in school, feeling that that is the best place for children to be and the best place for working parents to have their children. They are beginning to shut down other businesses and operations that don't directly relate to schools. On the other hand, the United States we have experienced in the last 2 weeks an 80% increase in cases, a 40% increase in hospitalizations, and deaths are back up near the 2,000 a day level. That is a terrifying place to be.
Well, I got to say, I hope we get better leadership in this next chapter coming from the top, because it's making all the folks I talk to on the state and local levels, their jobs that much harder. But Secretary, thank you so much for your time today. I appreciate it.
Good to talk to you, Richard. Bye-bye.
All right, when we come back, one such community. Well, we're going to talk about what's going on in Texas, where they've had more than 1 million COVID cases. Its biggest city dealing with a sharp rise in those cases. After the break, top health official in Houston, he'll fill us in on how his city is faring as it deals with another surge.